Hello, in this video, I'm answering this question that I was asked last week. Why do I have two periods in 1 month, each lasting 4 days, and then have some spotting a week later? This woman also mentioned that she has really bad mood changes, her back hurts, and intercourse is painful. Let's get into this. Without having had a medical consultation and only knowing these few details about this woman, I will share the possible causes of this frequent bleeding that she has, also the spotting, as well as the pain that's showing up. Let's unpack this mystery right now. Bleeding twice in a month or experiencing random spotting can be concerning for many women. In fact, I work with a lot of clients that have this. It's important to understand that these symptoms have a range of causes. Research and clinical observation identified several potential factors that may lead to these menstrual irregularities. These factors range from benign conditions to more serious health concerns, making it crucial for individuals experiencing these symptoms to make sure that they reach out to a professional and get an evaluation so they can have an accurate diagnosis and appropriate management of the symptoms. Ideally, one should look for the root cause. Ideally, we want to find out the root cause of why a woman would bleed more than once a month. So here's an overview of the causes based on scientific research. After I present these causes, I will share how this is diagnosed according to Chinese medicine and what to do about it. First, let's look at the Western scientific research. Hormonal imbalances, one of the most common causes women experiencing more than one bleeding episode per month or intermittent spotting is hormonal imbalance. Fluctuations in estrogen and progesterone, the hormones responsible for regulating the menstrual cycle, can lead to irregular bleeding. This imbalance can be due to various reasons, including polycystic ovarian syndrome or PCOS, thyroid disorders, and the onset of menopause and perimenopause. So you can understand why this can be really confusing to someone who's going through this. Uterine fibroids are non-cancerous growths in the uterus, while polyps are growths on the lining of the uterus or the cervix. Both conditions can cause irregular menstrual bleeding, including the possibility of bleeding or spotting between periods or having more frequent periods. Third is contraceptive use. Hormonal contraceptives such as birth control pills, patches, injections, or intrauterine devices like IUDs, especially when a woman first starts them, can cause irregular bleeding. This includes spotting between periods or having more than one period in a month. Over time, the body can adjust and the bleeding may normalize. If this is a consideration for you, make sure to reach out to your doctor and discuss the timeline and how long this has been occurring, track your symptoms, and learn if this is considered normal, and if it is, how much longer it will go on, and then look at what other options you may have for contraception. I can say that a really long time ago when I had an IUD, I had the Mirena, and I had spotting for the first 3 months, and I went to take it out, and then that's when it stopped. Everybody's different. If you don't know me, I'm Dr. Gina Rosella Terra Noni. I'm a board-certified holistic doctor of Chinese medicine. I'm also a certified women's healthcare integrative medical practitioner. I weave 2,000-plus-year-old medical practices with the latest in scientific research and medical protocols, including, but definitely not limited to, IVF, FET, hormone therapies. I've helped over 2,000 women and couples to become pregnant and have healthy babies over the last almost 25 years now. All the videos that I create on my channel have at least one actionable health tip for you to take the same day that you watch. Drop me a line below with the word hormones, and I will share with you my 10 steps to regulating the menstrual cycle. It's a checklist. We're going over why some women get 2 periods a month and have spotting or irregular bleeding. So far, I've covered 3 reasons: hormonal imbalance, possible uterine fibroids or polyps, and third, some forms of birth control can cause irregular menstrual bleeding. Let's get to 5 more possible reasons and make sure that you stay until the end where I cover how irregular bleeding is diagnosed uniquely in Chinese medicine and what you can do about it. Also, I'm going to let you in on a secret. I will I will share with you what caused me to experience having 2 periods a month for several months. You got to stay till the end. Okay, fourth up is infections, pelvic inflammatory disease or PID, sexually transmitted infections, STIs, chlamydia, gonorrhea, and other vaginal infections can cause irregular bleeding and spotting. These conditions require prompt medical treatment to prevent complications. So definitely get checked out if you're not sure, but you should be able to get screened for all of this. Fifth is endometrial or cervical conditions. So mostly we're talking about conditions affecting the endometrium, the lining of the uterus, or the cervix, such as endometriosis, which is inflammation of the endometrium. It does travel throughout the body, or cervical ectropion, which is when the lining of the cervical canal appears on the outer surface of the cervix. This can lead to abnormal bleeding patterns as well. Sixth is pregnancy complication. And it's not always complication. There's some spotting or bleeding can be an early sign of pregnancy, including normal early pregnancy. And I know from being pregnant myself and then working with a lot of women that anytime there's some spotting with pregnancy, that of course we get worried and concerned, but it's not always a concern, but it is always a reason to check in with your doctor and get checked out. The next reason would be ectopic pregnancy, where the embryo implants outside of the uterus, or miscarriage. It's crucial to rule out these conditions if there's a possibility of pregnancy. So that's really important to stay on top of that and be monitored by a professional, by a doctor. Seventh is medications and medical conditions. Certain medications, including anticoagulants and corticosteroids, can cause abnormal bleeding, as can medical conditions like coagulation disorders. It's essential to review all medical use with a healthcare provider so they can help you to get to what's causing it, if that in fact is the reason. And then eighth up is stress and lifestyle factors. Extreme stress, significant weight loss or gain, and excessive exercise can disrupt hormonal balance, leading to irregular bleeding patterns. I've experienced twice a month bleeding due to overwork and high stress. This went on for a few months. When it first happened, I was like, that's a fluke. And then it happened the second month, and I'm like, that's really odd. This never happens. I've got normal periods. And this is before I had my son. He's 11 and a half now. So it was definitely stress related. I was working 60, 70 plus hours of work. It lasted about 10 months. It was ridiculous. And I did have to leave that position that I was working on. And I've also skipped several periods. And this is interesting, right? Because this was due to when I was solo backpacking in Europe. This was a really long time ago. It was a few years after I got out of college. And I didn't feel stressed. In fact, I was having a blast. I was meeting tons of people. I was visiting incredible places. If you look at this like overwork, stress, high stress job, causing bleeding twice a month, and then the other end of that is not having a period due to stress. But travel is stressful. It can be stressful on the system. There's different time zones to factor in. And also keep in mind, when I was backpacking, there were no cell phones. So I had to navigate and understand new cities and towns and bus schedules and where I'm going to sleep in a hostel. So maybe it was stressful and I don't remember it. Now we are switching gears. I'm turning to Chinese medicine, and I'm going to walk you through the pattern differentiation in Chinese medicine and how it explains spotting and having bleeding twice or more per month. Check the next video. Thanks for watching.